If you look at this picture right here, right, the pink stuff is the actual lung tissue, but surrounding the lung that you can't see on this left side, you can see on the right side is this clear film. And that clear film wraps around the entire lung. It's called the pleura. And so in some patients, that sac gets filled with too much fluid. Now it's supposed to have fluid for lubrication purposes, right? And if you can imagine the pink part of the lung grinding against that blue part, the pleura, it glides when you have a specified amount of fluid inside, but like the fluid's like lubricated fluid, right? It's very
Mhm.
small amount, just enough to maintain lubrication. Also on the outside of the sac, like this would be the inside, right? That's touching the lung, but of course here it's open. The outside, well, that's touching the thoracic cavity, and thoracic means the chest, right? And so it's gliding when you're breathing in and out. But when that sac gets inflamed, friction is created, and now you have like pus that develops inside. That limits the patient's ability to breathe in because as the lungs expand, it hurts the fluid that's surrounding the sac. Now that there's more, it's pushing against the lung. And so that's what this is talking about. The patient has something called, there's different names for these disease processes, right? And so I want you to write down the following. The first thing that could happen in the lungs when that sac, remember the pleura, when it gets inflamed, it's called pleurisy. And then the second thing that happens is if that's not fixed, then you have something called pleural effusion. And that's just a fancy way of describing that now the whole sac is getting filled up with fluid that we don't want there. Okay. And then the last thing that could happen is something called empyema, and that's literally pus. And so if this is a lung, whoops, that's an ugly lung. So if this is the lung, right? One of the lung tissues, imagine the lung itself now is only up to there. The pink part is only here because all this part is filled with fluid and it's putting pressure
Mhm.
against the lung. So the lung cannot expand, and that would be an empyema. So in this case, the patient's having a thoracentesis because they got to put a needle in there and get that fluid out. Does that make sense?
Mhm.
That's what this is. So what happens to the lung when you take a deep breath? Does it go this way or does it go back up?
It goes down.
It goes down. So if you can
Goes down.
imagine, you're putting that needle inside. Do you want the patient to take deep breaths?
No.
No, because you're going to pop the lung. Now remember, the sac is different than the actual lung. If you pop the lung, now you have what we call a pneumothorax. We don't want that. So because of that, before the procedure, you have the patient exhale. So the lung goes up that way and the needle won't pop it. Does that kind of make sense?
Yeah.
Another thing that I want you to know is that even though there's fluid in the sac, the fluid's not inside the lung. So when you auscultate breath sounds, for instance, if you check the breath sound like right here, if this is where you put the stethoscope, you're not going to hear anything because there's just fluid in there, but there's no air coming in because the fluid is in the sac.
Right.
But if you put like your breath sounds, so in other words, all right here, anywhere here, you're going to have diminished or absent breath sounds. You're not going to hear much. Once you listen right here, then you could probably hear the breath sounds. So I want you not to get confused when you have this type of condition. There is fluid in the lung sac. You're not going to hear crackles. You'll hear crackles when you have pulmonary edema, because now that means that the fluid is inside the actual lung tissue. So there's a big difference between those two. Is that clear?
Mhm.
Cool. So we go back to the question. A nurse is assisting the provider to prepare the client for a thoracentesis. The nurse should instruct the client that which of the following positions will be used for this procedure. And the idea is that you want to just make sure that, I don't want to give it to you, but that the area is free, like that it's clear. So which of these positions do you think would be the best one?
Mm.